Before starting the initial bonding, the doctor will polish or reshape any rough or irregular edges of the teeth. This is performed using a donut burr placed in the high-speed handpiece. After the tooth edges are polished, the doctor may abrade and clean the back teeth using a greenstone. A micro etching or cleaning with prophy paste may be used in place of the greenstone. Next, the doctor will check the patient's bite, verifying if bite pads or bite turbos will be needed. If these are needed, the doctor will inform the clinical assistant to prepare these surfaces during the bonding. At this stage, the doctor would normally leave the chair and the clinical assistant would continue. For the first step, dry angles will be placed in the corner of the patient's mouth. These dry angles will help to retract the cheeks and also reduce moisture contamination from saliva. A Nola cheek retractor is then placed in the mouth. The tongue piece will then be inserted. Make sure that the blue cushions are attached to the tongue piece to help with patient comfort. To place the tongue piece, slide it on one side and then using cotton pliers, place it on the other. Continue sliding the tongue piece back until the back molars are well isolated. Make sure that the tubing is placed so that it is out of the way of bonding. Once the retractor is in place, hook the tubing up to the low vac suction. It's helpful to place the suction hose beneath the right arm of the patient. The first step of the bonding process is to etch the teeth. Begin by placing the etch on the lower left molar, then continue around the lower arch. Etch should be placed on the entire front surface of each tooth. Let the etch stay on the teeth for a minimum of 20 seconds per tooth. Continue placing the etch on the upper arch, starting with the upper right molar. Etch any teeth that will be receiving bite pads or turbos. Once all the etch is placed, rinse the teeth with water, starting from the lower left and continuing on to the lower right. Use a high vac suction when rinsing the etch. Thoroughly rinse every tooth. Once rinsed, begin drying each tooth using the air syringe. Make sure that each tooth is 100% dry. Once properly etched and dried, the teeth should have a chalky surface. If you don't see a chalky surface, re-etch and re-dry teeth. Once all teeth have been etched, begin placing the bonding agent. Place a bonding agent starting on the lower right and continue around the arch. Continue onto the upper arch, starting with the upper right. If bite will be placed, place the bonding agent on these tooth surfaces as well. Use the air syringe and make sure that all water is removed from the line by blowing air onto your glove. Once all water is clear, begin air thinning the bonding agent, starting from the gum side and blowing air towards the biting surface. Air thin the bonding agent until there is a thin layer on all teeth. At this stage, all the teeth are ready to begin placing brackets. Begin by picking up the lower left 7 and placing a small amount of composite on the bracket. You want a thin layer of composite that covers a bracket pad completely. The bracket is placed on the back molars, and then using an explorer, the doctor will position the bracket. In order to avoid moisture contamination, the 7 bracket can be cured immediately after placing. While the doctor is positioning the bracket, the assistant will get the next bracket ready by picking up the bracket and placing the composite. Continue by placing the lower left 6 bracket while the assistant gets the next bracket prepared. Continue placing and position brackets in this manner, starting on the lower left 7 and going up to the lower left 3. The height gauge is handed to the doctor to measure the height of the canine bracket. This height is usually set at 4.5 millimeters. After measuring, the assistant will hand the explorer back to the doctor, and then the assistant will do a quick cure of the brackets. Repeat this same process now on the lower right side. Place the lower right 7 and continue placing brackets up to the lower right 3 bracket. The height gauge will be handed to the doctor after the lower right 3 bracket. The height will usually be 4.5 millimeters. After final positioning, the brackets will receive a quick cure. Continue placing the lower 2 to 2 brackets starting on the lower left 2 and continue placing the brackets going from left to right. The assistant will hand the height gauge to the doctor for final measuring, followed by the explorer for final adjustment. The assistant will then cure the lower anterior brackets. Repeat this same bonding process by continuing on the upper right 7. Place the upper right 7 bracket and continue to the upper right 3. The doctor will measure the UR3 bracket. This height is usually set at 5 millimeters. After final measuring and adjustment, the assistant will cure the upper right side. Continue by placing the bracket on the upper left 7. Continue the pattern, going from the upper right 7 to the upper right 3. The canine bracket will be measured, adjusted, and then the upper right side will be cured. Starting on the upper right 2, the 4 anterior brackets will be placed. The upper 1s will usually be set at 5 millimeters, and the upper 2s will be set at 4.5 millimeters. The bracket heights will be measured and the brackets will be adjusted and then receive a final cure. If bite will be placed, now is a proper time. A small amount of band lock will be placed on the teeth receiving bite pads. Using a micro brush, the bite pads are adjusted and shaped into position. At this stage, the assistant will do a complete cure on all the brackets. Depending on the power of the curing light, a full cure will usually be 5 to 12 seconds of curing time for each bracket. Once all the brackets and bite pads are fully cured, the retractor can be used as one complete piece. The dry angle will be removed next. At this stage, the bonding is complete, and the patient will be ready for the initial arch wires.